listening to Unpause Your Life with Dr. Cali Estes and Master Coach Jenny Fontana, founders of the Life Coach Method. Each one of our uplifting and deep dive episodes is geared to help you tackle the things that hold you back from having the most magnificent life you deserve. Sit back, relax, and prepare to be coached.
Hey everybody, Dr. Cali Estes. Welcome back to an episode of Unpause Your Life, Manhattan Beach Edition. My guest today is Dr. Mel Pohl, whom you may know. He's fairly famous. Welcome,
Yeah,
Dr. Mel.
famous in my own mind. Yeah, good to be here, Callie. Finally, we got this together, right? The timing.
I know, it's been crazy. I apologize between the moving and the appointments and, life.
Yeah, there is that, but I'm glad to be here.
Awesome. Well, welcome and tell my listeners about you, who you are, what you do. I think most of them are going to know who you are, but tell us
Maybe
what you're
yes.
working on. What's new and exciting?
So I am a man in long-term recovery, 41 years sober, a physician, and the work that I've done for the last 30 years has been in the field of addictive disease, substance use disorders, and chronic pain. So the overlap of people who ended up on pain meds or are drinking or even not using substances, but who really their primary driver in their life is their physical pain, need help and they need specialized help. And the medical profession has failed them. Therapists really feel, in my experience, unprepared to really provide what's needed. And we get to do it. I work at a place, as you know, down the road from you in Malibu called the Pointe Malibu Recovery Center. And it's kind of heaven on earth. We're in 12 beds on the sand of Malibu. And so the physical plan is extraordinary. And in the last 4 years, I've gotten really interested in what we call the science of safety. Essentially, a person or a body under threat doesn't work very well. And what kind of threat, history of trauma, so many people. I mean, in my experience, 98% of the people that show up at our door have serious trauma, and usually it's sequential trauma, childhood experiences, and then life turns, and often medical trauma, surgical intervention that doesn't go well, and then they get gaslit by the medical community. They're misunderstood, and they need a place to go, ground in, feel safe, so that they can do the healing. So that's the short version of what I'm doing.
That's awesome. I was just talking to someone last night who was in a motocross accident and he broke
Mhm.
both his legs. And the doctors didn't tell him, we're going to put you on opiates and pain meds and you might get addicted. And here he is 2.5 years later and he's like, I got to come off this stuff. So he thought, oh, it's like anything else. You just stop taking it. Oh,
Yeah,
he said the detox was horrible and then the pain came back. And so
yeah,
he's battling that right now.
yeah,
So that's exactly what your facility does really well. It's a beautiful facility. I got the
yeah.
pleasure of seeing
You,
it.
yeah, we had a fun tour. Yeah, I mean the way I got interested in this is that I'm primarily addiction specialist, and I would treat people who, like your fella, who was in an accident, got put on medication with no exit strategy. And at some point, they realize either they don't want to be on them or they can't live without them. And what do you do then? Because there is an underlying pain condition. A couple of things that I learned over the years is one is that opioids make the pain worse, partly because there's this up and down effect of, if I take a pill, it has to wear off, and it wears off, then my pain goes up as the level goes down. And then it's this up and down cycle with tolerance and increasing dose. And then there's something really strange that I learned about 20 years ago called opiate-induced hyperalgesia. Opioids, the chemical opioid, are inflammatory. So they actually cause inflammation in the brain so that people feel more pain on opioids than off them. And I don't know if the guy you're talking about is going to have that experience, but most of my patients, the pain doesn't go away, but the pain gets less in the course of time when they stop the opioids.
Wow. So it's almost like it's designed that way. You have to keep taking
Well,
more and more of the The
we could
thing.
we could speculate about the nefarious drug companies that might have designed them that way. I think it's the nature of, anytime we take something from the outside to modify the
Mhm.
inside responds in a way to sort of balance out what we're doing to it. So, in that sort of blood pressure medicine, antidepressant. So, unless you have some modicum of ability to work with that balancing, you're going to be different on the drug. And then it stops working. And then we have to increase the dose, because of that balancing effect. So, it's a I guess a deficiency of our current medical protocols, which is we look at a bunch of symptoms, we make a diagnosis, and then we slap a medicine on, or we operate and we think that's going to be a solution, when you and I know that it's a whole body, mind body. And why we would ever separate the mind from the body, I can't understand. And then we get into this battle of, is it real or is it physical? Well, yes, it's real, and it's emotional, mental, physical. It's all the same phenomenon. And God, we missed that boat so bad, and we're in the midst of it right now. I mean, we have a society under threat, if you will, and people are really not managing very well with that,
Yeah.
and they need support.
You're right. I was just asked a question the other day. I had a client come to me and he said he was bipolar. And I said, well, when were you diagnosed bipolar? And he said, well, I went into treatment and I was detoxing. And I said, you got
Yeah.
diagnosed walking in the door in a detox? He said, yes. I said, you're probably not bipolar. Your body was detoxing and you're going through the
Yeah.
emotions of the detox. Let's
Mhm.
get you sober for 6 months and let's retest you.
Yeah, absolutely.
Yeah.
100%. And what happens, Callie, as you know, is people get on meds for bipolar, and now they're medicated and they have side effects of the medicine based on a diagnosis that's nefarious. I had a guy who was diagnosed bipolar when he was on cocaine runs. It's like, duh,
Yeah.
right.
Yeah.
I can't sleep and I'm high energy. Well, that's probably cocaine related, not bipolar related. So yeah, again, a lot of misunderstandings and I think we're well-meaning. Doctors are aiming to help people, but it's just, I wish, they could take the blinders off and see the big picture, which is, it's a nervous system issue, and that's what needs to be treated.
Speaking of that, you do a lot of stuff with the vagus nerve. Is my lead in for
I
that.
do.
Tell me,
Yeah.
I am fascinated with this, and you have a training that I have got to get into now that I'm stationary and I can take. Tell
Good.
me about this training. Tell me about what you learned and what you're using.
So polyvagal theory, created by Stephen Porges. A lot of your listeners may be familiar with him. He's probably 30 years old, and he essentially figured out that the vagus nerve moderates that safety that we were talking about in a very primary functional way. So the cranial vagus nerve, 10th cranial nerve, so there's 12 of them. The 10th comes out of the back of the brain and it travels all over the body. It's called vagus because it's named after vagabond, because it goes to every single organ system. There's 45 miles of nerve
Wow.
that make up the vagus nerve. So it's really complicated. It's intricately involved with all parts of the parts of the body, from the head to the toes. So what's the significance of the vagus nerve? Vagus nerve's function is to assess and maintain safety. So if things are going well, the vagus nerve turns on and it applies what we call the vagal brake, slows things down, allows us to take our time to breathe, to relax. If things are dangerous, the vagus brake comes off and we become activated in our sympathetic nervous system, which everybody's familiar with, fight or flight. Sometimes it's so overwhelming that we have to curl up in a ball and play dead. That's dissociation, or what's called the dorsal part of the vagus nerve that goes down to the bottom. But what the polyvagal theory tells us, it's the coolest part of polyvagal theory, is that the way humans find safety is doing what you and I are doing right this minute, which is listening to each other, seeing each other, smiling at each other, hearing our tone of voice. And I feel safe having this experience. I'm excited, so I'm a little sympathetic, but mostly I'm in what we call ventral vagus, which is the safe place that we can get to when we're co-regulating or connecting with other humans. And there's a lot of data that says in this world that we live in right today, people aren't able to regulate themselves. And the main reason that they can't do that is that they're isolated and they're afraid, and look at the news. I mean, who wouldn't be afraid?
Yeah.
So polyvagal theory tells us, and there are ways to actually hack into the vagus nerve with different stimulators. There's a neck device called Pulsetto. Just invented a musical track called Safe and Sound Protocol, which is auditory music that infuses safety messages. And we use both of those at the point. And what ends up happening is it's not a cure for anything, but when the vagal brake, you activate the vagus, the brake comes on and everything settles down. And in that state, we can begin to do the work. If you can't heal until you feel safe.
I have so many questions because I find this so fascinating. I love this stuff. So here's my first question. Can you, in theory, teach people to do this themselves without all of those tools? Is that
Yeah,
possible?
absolutely, 100%. Yes. In fact, we do teach people. There's a number of ways to activate the vagus nerve. What I mentioned was these hacks, biohacks, if you will, which are devices or music tracks that are available. But the vagus nerve is activated by things that cause us to relax. So think about that. What's the best way to relax? Take a deep breath. And as you exhale, you are communicating to your brain that everything is safe because you don't have time to breathe deep and long if there's a rhinoceros about to attack. The safety message activates the parasympathetic or that dorsal vagus nerve so that we can rest, digest, settle in, and be present. Now, there's other things to do besides, and there's ways, by the way, of patterning breath that actually are more activating. So there's a breath called 4-7-8. 4-7-8 is 4 in, hold for 7, exhale for 8. 10 of those first thing in the morning resets the vagus.
Wow.
One of the really simple ways to train or activate the vagus is yawning deeply along with a deep breath. When we yawn, the diaphragm is contracting and we are actually activating the vagus. What else? Mindfulness practices. If you are in any form, it doesn't have to be any particular structure or methodology, but being present in the moment and focusing not on your thoughts, but on the fact that you're thinking so that you can direct to another force. And the breath is a good one, but a mantra is a good one, or a sound is a good one, or walking can be an activator of mindfulness practice. But mindfulness meditative practices stimulate the vagus, that relaxing effect. So that's 3 easy ways. Going for a walk we get to go to the beach, right? You're a block away.
Yeah.
I'm looking at the ocean from here. So nature, for whatever reason, stimulates that safety message and says, "Oh, the world is really much cooler than the news tells me, and I'm going to participate in that part of the world, not in that awfulness that's, coming through our 5 senses as we walk around the world." And then co-regulating, being with people. So rather than isolating, connecting with others is a wonderful way to stimulate the vagus.
So here's my next question. So in your scope of work, because you've been doing this for a long time,
Long time.
how hard is it? I don't want to
Mm.
say the normal person, but the average human versus somebody who has an addiction. When you're
Mm.
teaching them how to calm down and use this new technique, how hard is it for somebody in addiction who's always in chaos, always in
Mm.
fight or flight, where that's normal to actually wrap their brain around, you've got to do a 180 to get
Yeah.
calm. How hard is that for you?
What a fair question. There's so many variables that go into how an individual does. I mean, just to frame the conversation, we have 50 to 100 billion brain cells, each of us in our brain, trillions of connections. And that's what we're talking about. We're talking about modifying the way cells communicate with one another. What we're doing with these clinical techniques is we are growing new connections with our brain cells that stimulate relaxation and comfort and joy and presence rather than chaos and activation and anxiety. Put addiction in the picture, whether it's chemical or behavioral, I am dysregulating my system by ingesting chemicals. So the very first thing that has to happen in my experience is the drugs or the behaviors, if it's spending or gambling or sex, have to be, they have to be removed because the nervous system has to recover from that bombardment and that shifting, because again, remember, you take a drug, a depressant like Valium or alcohol, your nervous system is doing this. So you are in a state of activation in response to the sedative effect of the drug. Take the drug away, you feel pretty terrible for a while, and then you re-regulate. So how long does that take? It takes a while. It's not overnight, takes weeks to months for just that reset.
Mm-hmm.
So in that sense, it's harder to work with people who have addictions than it is for people who don't have addictions. But you and I know that people who had traumatic experiences, their reset is as high as anybody who's ever touched a chemical, and can be really tough to effectively impact their nervous system. Again, we do it very systematically, very gradually, and it's a slow walk into a new way of thinking, a new way of responding, and a new way of experiencing the world. And the key thing that I've learned, I mean, I've been doing this forever. However, I'm learning new things all the time. And what I learned is that this comes from a guy named Bessel van der Kolk, famous trauma specialist, who said the body keeps the score.
Mm-hmm.
So what we need to do clinically, and if you have somebody that you care about, is to work from what's called the bottom up. So be aware of your physical considerations, what's happening in your body, because that informs your thinking and your feeling, rather than talk, and try and change your body with your thoughts. Not as effective. So we do a lot of bottom up stuff at the Point that is really very effective.
That's awesome. I remember the first time I have a bad shoulder injury, and I was working with a somatic therapist, and she said to me, she's like, it's not just your injury. You keep re-injuring it because you're shouldering all the responsibility. And I looked at her and I said, what?
Yeah.
Like, wait a minute, what? And I'm like,
What?
oh yeah, the whole family and the drug
Yeah.
addicted husband and the big company. And I'm like, yeah, there
Yeah.
might be something to that. So I started focusing on the mindfulness, and just every
Yeah.
time my shoulder would tweak, I realized it was like this, and
Yeah.
just loosening that. And
Yeah.
just being
Yeah.
aware. Like
Yeah.
the first layer took a
That's
lot of,
it. That's it.
concentration.
Yeah. Yeah. That leads me to a whole bunch of suggestions. One of which is we call it the 3 N's. You notice is the first N, just what you said. My shoulder's tweaked. You name it. My shoulder's tweaked and I'm anxious or I'm pissed or I'm frustrated or I'm, whatever. And then you nurture yourself. That's the third N, is nurture. And I'll tell you what, this actual physical action of rubbing your chest or tapping on your chest, what are you tapping on? You're tapping on your heart, and your
Yeah.
heart is, sort of the genesis of a lot of that emotional distress. So that's one thing that comes to mind. The other is the importance that you pointed out of motion, because
Mhm.
I say motion is lotion. So I have bad shoulder too, but I religiously exercise my shoulder to the max, even though it's uncomfortable. And one of the things we teach people with chronic pain is that hurt doesn't mean harm.
Mhm.
And just because you're hurting doesn't mean you're hurting, you're injuring yourself worse. And it is the belief that I'm hurting myself that causes us to do a lot of the things that make the pain worse. Like if I believe I can't do that, then I limit my motion. If I limit my motion is limited, and then I'm frozen. And
Yep.
if I have a frozen shoulder, there's even more pain. And what I do in response to that is I brace. And if I brace
Mhm.
with anticipation, everything gets worse because I'm activating the sympathetics again. Bracing is, uh-oh, what's wrong? So
Yep.
we do a lot of cognitive reframing, but also somatic reframing of how do I think and feel about this pain. I feel like it's something bad's happening. It's dangerous. In fact, the doctors tell me all the time. I had a woman who came to me and she said, Doc, my spine is degenerating. It's crumbling right here, right now. I have degenerative disc disease. I said, ma'am, everybody has degenerative disc disease who's over 30. It's
Yeah,
like wrinkles. It's the aging of
yeah.
the spine. And it was such a new concept to her because she was so fixed on, no, 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 you don't understand. I've seen the x-ray. I can show you the spot. And what that's about is a belief system in the brain that something's wrong in the body. And it turns out there might be something wrong in the body structurally, but it's much more important how I think and feel about it and what I am convinced of. It's like I tossed you a softball and your brain thought it was a hand grenade.
Hmm.
And you're holding a hand grenade according to you. And I tell you it therapeutically, look, it's just a softball. Feel it, touch it. Know that that's your shoulder is fine and you can move and your exercise will improve your well-being. And, it's not instant, but we see people transform in the course of care.
Hmm. Yeah, absolutely. I do yoga. I'm a big yoga person, and I haven't done it
Lovely.
since I've been here, and my
Ah,
shoulder's acting up. Yeah. So I did
ah,
yoga mat out this morning,
ah.
and I'm doing my downward dog, and my shoulder's going, we're not doing this. And I'm like, oh, we're doing this. Deep breath,
Yeah,
we're moving through. And
yeah,
it's been better today. It's sore, but it's better
yeah.
now because I'm like, we're gonna motion.
Yeah, so fabulous. I was going to say, if you're not doing yoga, better do yoga. But also, the yoga is a great example because it is both bottom up because you're moving your body. It's also top down because you're finding the pose and you're entering the pose and you're dealing with your thoughts. But yoga teaches us in a brilliant way to work with the edge.
Hmm.
So, move to that sore spot and then move back. But don't stop just because it hurts. Move back and keep moving. And what you'll find is that you can move more as
Hmm.
you continue to stretch and exercise. Because again, a lot of the restriction and the pain comes from the fascia that's tightened up. And you know what supplies the fascia? The vagus nerve. Vagus nerve supplies the
Wow.
soft tissue that connects everything in our body. I just heard Porges give a talk about fashion. It's like, oh my God, this is so cool. So yeah,
Very cool. So I've got to get in your
yeah.
training now. I have to. I've been
It's
dying to do it. So now's the time.
it's we just started the next module, so you can go to the one after.
Perfect.
Or I think they're full. They take about 150 people. And I just did the first. But it's I think 10 or 12 sessions with all sorts of different kinds of people instructing, and they're really good. They're really smart. They're really experienced. I feel excited and honored to be a part of that effort. That's the Polyvagal Institute training.
Yeah. So if you guys are listening, we'll put that in the show notes and we'll also put the point in the show notes so people can find you. And I'm
Great.
sure they'll reach out to you with 50 questions on this. So
I'd
please
be
don't
happy to.
bombard him with lots of
No, it's
questions.
okay. That's okay.
But this stuff is awesome. And I want to see if there's anything you'd like to say in closing or offer our listeners because we're just about out of time. And I want to thank you for coming on too.
God, it went fast. Just if you're listening and your interest is piqued, it's like, and some of you are out there saying, bullshit, this can't be true. Okay, welcome. But really, if your interest is piqued, do some investigating. And there are places to look. I have a book called The Pain Antidote. There's a wonderful book about pain reprocessing therapy called The Way Out. Comes from Alan Gordon and his group, and they talk about using what I've just talked about physically, practically. There's a couple of apps. One is Curable, Curable, and the other is Menda. And those are actual groups that help you apply these techniques. And if you want to come and see us at the Pointe Malibu, I mean, it's a comprehensive, amazing place where our underlying interest is in helping people find safety in a chaotic, frightening, tough world. And the joy is inside, and the joy burns away the pain.
Awesome. Well, thank you for coming on, and I'll put all that in the show notes so they can buy your book and they can find you.
Great.
And this is Dr. Cali Estes with Unpause Your Life, and my guest today was the famous Dr. Mel Pohl.
Thank you for listening to Unpause Your Life with Dr. Cali Estes and Master Coach Jenny Fontana. Head over to www.thelifecoachmethod.com to learn more about coaching yourself and how to become a master coach.